here we're going to talk about our fourth tenet of naturopathic medicine, which is doctor as teacher, or docere in Latin. So I love that this is one of the tenets of naturopathic medicine. I love teaching about health, and I think it's so important that this is part of the fundamentals of naturopathic medicine, because it means that we all need to be focusing on helping our patients improve their health literacy. So this means giving people more knowledge so that they can be healthier for longer, and on their own often, just being able to access more knowledge about health and understand what is going on in their body. So we do this through education and trust-based relationships. I talk about this in every single video, the importance of a trust-based relationship with your provider. And so helping patients to understand every step in their health and in their treatment plan, and why we feel like they may have come to this condition of disease or something like that, and how they can help themselves and help nature repair it. So I love doing health education, and I implement it in a couple of different ways in my community and with my patients. So one of the biggest things I do is free monthly health talks and things like this. So follow me and follow Sprout Kimberly. I do almost all my health talks in town locally and then online now with Sprout Kimberly, and they're an amazing health food store in Kimberley, BC. And we do all our event updates there, as well as I do tons of blogging, and I do lots of info on social media. If you're watching this, you probably know that, but you can always check out my blog for more information. And then on a more clinical level, there's a couple of different things I do to help with patient education. A super important thing is called a PARQ. So this is something that all doctors learn when they're in school, and we should be doing it with any kind of treatment or procedure or test that we're doing. So the PARQ stands for procedures, alternatives, risks, and questions. So anytime that I'm offering a test or a treatment or any kind of procedure to somebody, we need to be going through all of those things. What are the alternatives to it? What is the risks of doing this? What is the risks of not doing this? And then making sure that our patients get to answer any questions. This is very, very important in naturopathic medicine, I feel, especially because we have a lot of tests that are not covered by different healthcare programs, and that patients need to pay for themselves. So making sure that we go through all of the different things of, if we spend this money, this is what we will get. If we don't, these are the risks. And just explaining my clinical process, I find is super important to helping people understand exactly why we're doing what we're doing in clinic. And that helps us get better results. I find that this really helps get patients on board with what they're doing, and we never are going in a direction that feels uncomfortable or that the patient is questioning. And that is why education and communication and trust is so important, so that me and my patients can always be on the same page of trying to figure out what is going on with their health. And then another thing that I really encourage all of my patients is to learn to notice the effects of different medicines and treatments on themselves. There's so many safe and effective natural medicines out there, herbs and homeopathy and nutrition. I think nutrition is one of the most important things for people to get a handle of on their own. So everybody's going to respond to different foods differently. Some people do great on all the different kinds of diet. Name a diet, somebody does great on it, somebody does bad on it. So figuring out exactly how your body works with different foods is really, really important. And that enables us to be able to implement different nutrition choices when we need them in our lives. And helping people to learn how to use different medicines with their own body, that increases our self-agency and our ability to achieve sustainable and long-lasting health. And we've talked about these in all of the other principles of naturopathic medicine, how we need to have sustainable health for ourselves and for the environment. And so teaching people how to use that little tincture that they have at home, or like, you can eat sugar, but don't eat it, at this time of your cycle or at this time of the month or of the year or something like that. Allergies is a great one. I just had a great chat with someone. They're doing so good right now. And we were like, okay, maybe when allergy season comes up, these are the things that you need to implement to keep your allergy symptoms lower. And in the winter, it's not so bad. So you don't need to be doing such dietary changes or supplements. So giving people that information is going to help them be able to maintain their health in the long run, which is super important. And also I love teaching. And so if you ever have questions, feel free to contact me on social media about any of the things I'm posting about, and always check in for my health chats in October, later in this month, we're doing a Q&A with Dr. K with Sprout Kimberly. So look out for that, and I'll be posting links to that all over.